Well, welcome to today's talk, and I hope you're having as good an Easter as possible in your individual circumstance. Now, cases around the world are going down as billions of people are becoming immune to this virus. Now, let me give you the evidence for what I'm saying here. This is from the World Health Organization report. We see this incredible Omicron increase in cases, but now they are going down quite dramatically. Now, of course, this is cases. Cases is only a subset of infections, and we know that a lot of people are simply not getting tested. But the trend is definitely there, and I think we can know that from the death line as well, which is coming down. This is the line of deaths here, this dark line, and we do see it dropping off really quite dramatically. So that is encouraging, and billions of people are becoming immune to this virus now, or having high degrees of immunity to this virus. And let's look at this according to regions. Now, here's the Africa region, which of course we have been worried about, and we see that the cases are really down quite dramatically. Clear waves in Africa there. Now, we know that Africa has been grossly underreported, of course, but we can still see from the testing that's been done that the waves are clearly discernible. And the deaths in Africa are well down. Now, we do know that there's been debate about the deaths in Africa. Is it just that African deaths have been underreported? I mean, this was certainly the case in India. There was way more deaths in India than were reported, and we've looked at this since we've looked at excess death data recently. But we do not believe there's been lots of unreported deaths in Africa. There's been some, but not on a massive scale. So basically, this pandemic has been nothing like as bad as could have been anticipated for the Africa situation. So down there quite nicely, regions of the Americas, and again we see the cases are down. Okay, there's not testing everywhere, but they're down, and death rates are down as well. So again, good news for the Americas. Eastern Mediterranean region also following a very, very similar pattern there as well. Cases and deaths going down really quite dramatically. European region, still quite a lot of cases and deaths in some countries. As we'll see, Germany, for example, still quite high because they went onto their Omicron wave later. But still the trend is downwards, and the trend in deaths is downwards. Pretty good news. Likewise, we're seeing similar trends in the Southeast Asia region. This really is a global picture. Now, this is the Western Pacific region, and you'll notice that the cases there aren't down as much. Now, this is largely because of South Korea, where they've been having quite a significant surge recently. It is starting to go down now. But of course, South Korea is medically very sophisticated, and they've been doing a lot of testing. So that means that these are transposing through into increased numbers of cases, whereas most parts of the world simply aren't testing as much. So even though there's a lot of infections, they're not coming up as cases. But there has been this resurgence in South Korea just starting to go down. Now let's look at some of the detail from the WHO report. In terms of sequencing, there's 379,000 sequenced cases reported globally, genomic sequencing. And 99.2% of these were Omicron, 0.1% were Delta. Of course, there were a few that they weren't able to specify, but we see that Omicron has taken over. We know that BA2 is now taking over from BA1. And it looks like these new subvariants that have been identified of BA2 will become the predominant form of BA2. That's what I'm expecting to happen. Omicron variant of concern, several descendant lineages under consideration. Now, the World Health Organization, of course, has identified BA1 and BA2, but also BA3, and BA4 and BA5, other variants, subvariants of Omicron, have been identified in Botswana and South Africa. Now, it looks like the fairly advanced genomic sequencing that South Africa does, covering South Africa and Botswana, are why these have been discovered there, because they also seem to exist, the BA4 and the BA5, in Belgium, Denmark, Germany, United Kingdom. But what I think will happen is the new variant of the BA2, the subvariants of the BA2 are so transmissible that these are probably going to outcompete these other variants. So these may well die out. We don't know that yet, but that's probably what will happen. Now, the BA1 and the BA2, the so-called XE recombinant forms, are still around, but no significant sign that they're going to outcompete the BA2 subvariants. Now, the XE, which is the recombination of the BA1 and the BA2, is somewhat more transmissible than the BA2 on its own, but the natural evolved subvariants of the BA2 seem to be even more transmissible, the ones that are currently circulating widely and have been identified in New York. So it's the BA2 subvariants that I'm expecting to carry on with global dominance rather than the BA3, BA4 and BA5. But remember, don't get too worried about these because they're all Omicrons and there's no evidence that these are causing more significant disease or hospitalisation, which is the important point really. Anything else you could argue is somewhat academic. Highest new weekly deaths. Now the United States, still a lot of people dying in the United States, but it is down 9%, which is good. Republic of Korea, of course, have had a significant surge just recently, but deaths there down 6%, which is good. And on the week, Russian Federation, still a lot of deaths, of course, but down 15%. Germany, they've had a big surge at the moment, but deaths down 6%. Brazil, deaths down 22%. So these global surges are all on the way down now. And of course, deaths are a lagging indicator. The deaths tend to go down last. So we can be fairly sure that we are coming over these surges and that they've left huge amounts of immunity in their wake, which of course is the good thing about these surges. Now, Africa, lowest cases since the pandemic began, which is really good news. So from a peak of 308,000 weekly cases confirmed, the real number was way higher, of course, down to 20,000. So even though that's a subset, and that's a subset, we can see there's a significant drop off, but the number of infections in Africa, of course, has been consistently higher. How high they've been in Africa is a matter of debate. Some studies say 65% of people in Africa have been exposed. Some put it as high as 85. I will think the higher estimates are probably more likely to be accurate, accounting for the fact that the disease is basically disappearing in Africa, which is really good news. So cases down in Africa 29% on the week, deaths down 37%, but this was on a very low level. So there was 239 deaths for the week, so it was down 37% to 239. But of course, this is for the entire African continent. There's some underreporting of deaths, of course, but we believe that deaths are being reasonably accurately reported in large parts of Africa. We're not missing thousands or tens of thousands of deaths in Africa as we did in India. That is the consensus of opinion from African authorities that we've looked at in previous videos. No country in the region is currently seeing an increase. So that's no country in the African region is seeing an increase. It's going down everywhere. But slight proviso here, Southern Hemisphere winter is coming on now. So South Africa, there's a high risk of another wave of new infections, according to the WHO. There could be more infections in South Africa, especially as the more infectious forms of the BA2 will spread around the world. There's no question that these subvariants of BA2 that are in New York now are going to spread around the world. And you could argue that that's good because it's going to generate more infectious disease, as far as we know, not more pathogenic, and therefore greatly accelerate the rate at which herd immunity is becoming established. Or herd immunity is probably the wrong term, but the move towards minimally clinical or subclinical endemicity is probably a better way to put that. Because we're going to be with this virus is going to be with us for some time, but most of the time, most of us aren't even going to notice we have a recurrent infection, if indeed we do, or it's going to be asymptomatic. Dr. Moiti, World WHO Africa Director. With the virus still circulating, it is, the risk of new and potentially more deadly variants emerging remains. Okay, it does, but so far we've seen more transmissible variants more than more deadly variants, so I'm hopeful that's going to continue. And the pandemic control measures are pivotal to effect a response to the surge infection. And the pandemic control measures are pivotal to effect a response to a surge in infection. Well, the data we've been getting from Uganda is everyone's been completely ignoring this for some time now. We're getting that data from Kenya as well. So I'm not so sure that he's right about that. I'm not so sure that it's because pandemic control measures have been taken. I think it's because natural immunity has been greatly engendered. So I'm not sure he's right about that. Okay, it might be nice if people took precautions around Africa, but we know the fact of the matter on the ground, at least from where we've been getting reports on this channel, which is okay, it's only 2 or 3 places in Africa, but we know that basically people have gone back to a normal life there, which you could argue is good because it's going to generate even better levels of immunity. Now, Dr. Tedros, the academic and director of the World Health Organization, politician, repeated warnings that the coronavirus would devastate Africa have not come to fruition. Most African infections are asymptomatic, according to this report now. So, no, to be fair, we did have some fears about Africa as well, but it hasn't come to fruition. And let's make quite a clear point here. This is not because we've been doing clever things. Only about 11% of Africa is vaccinated at all. This is because Omicron has generated such large amounts of natural immunity in the African situation, which is good. And I'm expecting that to have cross immunity against any potential variants. So quite a sight of relief for Africa there. Couldn't be more pleased about it. We were worried about it. Infections going down around the world. There will be this blip, the BA2 subvariants in the States, because the BA2 bounce has been expected in the States, but I'm expecting the BA2 that's already infected large parts of the population in Europe and the UK, for example, to give ongoing cross-immunity against the BA2 subvariants, because, of course, most of the virus is the same. The subvariants have only got very minor changes, and we've developed a polyclonal response, giving us antibodies to BA2 and stimulating B cells and T cells to BA2. And of course, these are just other forms of BA2. That's all they are. So globally, very optimistic. The United States has got their BA2 bounce to go through, so I'm expecting cases to go up there quite dramatically in the next few weeks. I'm expecting it not to be associated with huge surges in hospitalizations and deaths. But globally, the trend is good, and the United States will be following the global trend as soon as it gets past its BA2 bounce. So that's my assessment of the situation so far. If it's wrong, we'll come back and correct that. But I think we can be fairly optimistic this Easter. But of course, it's Easter 2022, and we've been reporting on this now since, on this channel at least, since January 2020. So this has been a long pandemic. But it is good to see this good news as the less pathogenic Omicron variant spreads. Even the low vaccination around the world has been, I think we could say, patchy at best. So not a triumph for humanity, but a triumph for the natural reduction of the pathogenicity caused by evolution and natural processes. Thank you for watching.